Baby nurse Jessica here. So I take care of moms postpartum and their newborn babies, and I wanted to go over some basic postpartum with you. So this is the period after you have your baby and you deliver your placenta. The placenta is that piece that's been attached to your uterine wall that has the umbilical cord that's been attached to your baby that's providing all the nutrients it needs. So they'll go ahead and deliver that. If you had a vaginal delivery, they'll go ahead and sew up anything as well that needs to be happening down there. And then after that, they'll go ahead, or somebody during that process will go ahead and rub on what's called your fundus. So this is the top of your uterus. And they're rubbing on it to make sure that it's nice and tight. So if you think about a muscle that's like been used a lot, it should be nice and firm, right? And if it's not nice and tight, then it could end up causing some bleeding issues. So they want to make sure that they're getting on top of it. They do what they call a uterine massage if it's not nice and firm. Don't get excited. It's not like a regular massage. Most moms totally hate this part, but we do want to make sure that it's doing what it should. If it's not for any reason, they are able to give you some medicine either by mouth, IV, going into a muscle of some kind, or even rectally if they need to. And they give most moms now in the United States anyway, Pitocin after you deliver that helps that uterus contract. Breastfeeding actually does the same thing where it does release hormones, oxytocin, the natural version of Pitocin that helps with your uterine contracting. Every mom is going to have postpartum bleeding, including C-section moms. So you'll have some bleeding afterwards as well. If you had a vaginal delivery, they typically put on like an ice pad for you to help with all that swelling that does typically happen there. It's good to use those for the first 24 to 48 hours, or depending on how much you like it, rotating in between an ice pad and a regular pad can be helpful. Most hospitals, they do have like either Tux pads, a spray, a cream, some kind of foam, something that will help with the pain or swelling down there. And so you can always use those as well. A lot of people now are making like homemade ice pops for your pad, so you can do that as well. But make sure that you're changing that often to prevent any kind of infection. You're also go ahead and get a peri bottle. It kind of looks just like a squirt bottle, and it's to rinse off down there. So every single time you go pee, I suggest changing every like 2 to 3 hours before you feed baby. But you can go ahead and rinse off and then just kind of pat dry. If they give you any kind of things that are like adult baby wipes of any kind, you're just go ahead and pat them and then put them in the trash can. You don't want to put them in the toilet because they do typically back those up and they end up coming back at you later on. So we don't want that. So make sure you use the trash can for those. I suggest that you go and change it every 2 to 3 hours because most of the time that's how often you're feeding baby. So a good routine to kind of get in is to go ahead and get up, go pee, change everything, check baby, and then go ahead and feed baby. I say this because whenever you breastfeed, if you're choosing to breastfeed, every time you breastfeed, it helps that uterine kind of contract back down. So you have a lot of cramping that happens with that. And your bladder is right next to your uterus. So if your bladder starts pushing on that uterus, it causes a lot of pain, and it also can cause a lot of bleeding issues. This is why if a mom is having too much bleeding, they'll rub on the uterus and it's pushed over to the side. It typically means that the bladder is full, and they will do a Foley catheter to empty that. Most places do give you a little bit of time to go pee after delivery before they look at doing a catheter, unless the uterine is going ahead and moving over. Everyone's a little different on how long they bleed for. I wish there was a clear time on it, but there's really not. Some people it's just like a week or so, other people it's the whole 12 weeks, so it's a little different for everybody. There are a couple things postpartum that you're at a higher risk for just because you had a baby. Yes, some people are at a higher risk for different risk factors, like maybe how many deliveries they've had, how big they are, their ethnicity, any kind of history from before, like blood pressure issues. But everyone's at risk for complications postpartum simply because you had a baby. Some things we're going to be looking at is your legs to see if there's any pain or swelling. So first, let's talk about for pain. Everyone's at risk for blood clots postpartum. Your blood kind of thickens up towards the end of pregnancy, and you're at a higher risk for blood clots postpartum. And so we talk about any time that you feel any kind of hard redden areas in your calf, one leg looking a whole lot bigger than the other, don't rub it or anything. We want you to go ahead and come into the ER to get that checked out because it could be a blood clot and we don't want it lodging up somewhere. Sudden shortness of breath is another thing because you could get a blood clot that travels to your lungs and that can cause sudden shortness of breath. I've actually had a friend of mine who had a fall while she was pregnant. Everything looked good, but she ended up having a blood clot that did end up going to her lungs. She is okay, but it was because of the fall is what they're thinking in her ankle. So everyone's at risk for blood clots postpartum. Another thing when we talk about swelling is everyone's at risk for preeclampsia postpartum. We hear a lot about it during pregnancy, which you are at risk for it then, but postpartum, you have a chance as well because you did have a baby. You could have no risk factors, be totally healthy, and still end up with it. I've actually had friends that it was their third baby. They've had nothing wrong with them during any of their pregnancies, postpartum, nothing. Their third baby, they're like an active runner, really in shape, no risk factors, and they end up with preeclampsia and have to be back admitted to the hospital to be on MAG to help lower those pressures. So with that, we look at swelling first in your feet. A lot of people get swollen postpartum and it's totally normal. It's nothing to worry about. But if that swelling continues, it goes up to your legs, especially if you start seeing it in your face at all, then those are risks that it could be turning into preeclampsia. Your blood pressures being high could also be another thing. And then also any kind of headache, blurred vision, seeing spots, even if it's a dull headache. I don't want you to just brush it off to being like, oh, I just had a baby, I'm just really tired, or maybe I have a headache because I need to drink more water, I haven't been taking care of myself. No, we want to go ahead and have that checked out. They can also do some lab work checking your urine protein levels as well. So they may have you do some blood work, or they may also have you do a urine sample to check for those things. It could happen even weeks after delivery. Postpartum preeclampsia and eclampsia isn't something you want to mess with. It could actually lead to a lot of injuries like seizures or even death. So if you're having any of these symptoms, please go ahead and get them checked out. Some moms, after if they've had postpartum preeclampsia or gestational hypertension, they do have them come back just for routine blood tests or blood pressure checks as well. So I did mention how postpartum swelling is kind of common in your legs, right? So some things that you can do with this is help drink some water. So water lets your kidneys know, hey, I can get rid of some of this fluid. Let me pull it back into my stream and go ahead and get rid of that. So drinking water is super helpful. And then also keeping your feet elevated whenever you are in bed. So don't sit in a chair and let them dangle. It makes it worse. Go ahead and have them propped up and that will help some with it. Rest is also really important postpartum. I know that's hard to get, especially with a new baby, but you want to make sure that you are getting rest. It will help your body recover faster. And getting up and walking is kind of that balance between you don't want to do too much and hurt yourself, but you also want to get moving and let your body know that you are okay. So walking around the house, going on a walk, things like that is really helpful. I love seeing moms taking strolls in the hallways because that does help with their recovery. I want to let you know that everyone's postpartum period and every postpartum is different. Some people, they have a whole lot of issues. Other people handle it just fine. Some pregnancies, you have a good postpartum and other ones you don't. Other things postpartum to think about is postpartum thyroid issues are really common and postpartum gallbladder issues are also fairly common. So sudden sharp pain right here could be an indication of gallbladder issues. And postpartum thyroid, you can have blood work tests. So even if something just feels off, even if it's too much thyroid or too little, you can go ahead and have that lab work checked as well. Postpartum anxiety and postpartum depression is a real thing that happens in a lot of women, and it can actually happen with your spouse as well, as oddly as that may sound. And so the first 2 weeks they talk about how your hormones are highs and lows, and so you're gonna have them all over the place. Happy tears, sad tears are super normal. I jokingly say that I remember crying about my taco being delicious, so if you're doing that, that's totally okay. But lasting longer than 2 weeks, having any thoughts of harming yourself, baby, or just unexplained sadness that won't go away. It doesn't have to be triggered by anything. Having a hard time with just day-to-day things, you definitely want to get that reached out. Postpartum sweats are common too. So I remember coming home and waking up about day 4 postpartum and being drenched in sweat, and my milk had came in. It's a super gross thing, but it is common for those things to happen. So going back though to postpartum depression and anxiety, I just want to let you know, if you're experiencing any of those things, it's nothing that you've done wrong. It's not anything that you should be ashamed about. It is something that you should reach out for. I myself had some postpartum depression. I think it was also partly with the job change and not having that support system that I was used to. So make sure you do have a good support system postpartum, because there's a lot of changes that happen, and make sure you're taking care of yourself and baby. Some people look at having a C-section as just like, oh, whatever, I had a C-section, but it is major abdominal surgery. So you do want to take it easy. Some people look at having a baby as like, oh, I had a baby, it's fine. But no, you're healing. That placenta we talked about, it leaves like a big open spot in your uterus, and that's healing. So you want to take it easy, listen to your body. If it feels like too much, it is too much. And sometimes if you do too much one day, your bleeding can pick up. Postpartum hemorrhages are actually something that can happen as well when you leave the hospital. So if you're saturating through a pad an hour, having blood clots bigger than golf ball size, then we want to make sure that we're knowing about it. If you're in the hospital, the nurse will want to look at those things. There's a lot of things like I talked about for postpartum, and everyone's different, but do look out for those things. Anything left over typically in your hospital room, they throw out. So take home all of those supplies. I know some women that love Depends postpartum because I feel like everything's nice and secure. That's something you can do. And we talked about how some people will make those pad popsicles as well, because it just feels good down there. If you have any kind of questions about postpartum, or maybe experience that you had that you just want other new moms to know, go ahead and comment below. And remember to subscribe to my page. Next week, I'll be talking about a lot of breastfeeding stuff. How do you know your baby's getting enough, especially in those first couple days, what to expect. So go ahead and subscribe for more. Mother Baby Nurse Jessica.